Health Minister for Luxembourg, Lydia Much, you've just launched today the Council Conclusions on Personalised Medicine. What can you tell us about them, and are you happy?
Yes, I'm quite happy because personalised medicine was one of my priorities during the presidency. It has been a subject many times during presidencies, but mainly looked from an economic or from a research part of view. But we want to have it patient-centered, so the patient is in the focus of our interest. And that makes it interesting, and that makes it really unique for presidents.
Now, your organisation has had a lot to do with the Luxembourg presidency. Today, the Personalised Medicine Council conclusions are out. Are you happy?
Very happy. I mean, it's a great achievement. We've brought, now for the first time, there's a framework to put personalised medicine on the map at EU level. The Americans have done this 8 months ago. Now the Europeans have it. And it puts a framework in terms of research, big data, how to improve patient education, how to improve patient access, and bringing together all the stakeholders.
We're looking here at new therapies. We have to develop new frameworks to allow these therapies to come to the patient really quickly. And so we will have to reshape our way of thinking, our way of working, but also member states will have to make sure that things are getting implemented. And so I want to see a lot of ambition.
To succeed in getting the benefits for patients, we need to put a regulatory regime in place in the European Parliament and together with the Council of Ministers to ensure those benefits are properly derived for patients.
What we mainly focus on is to give the patient more empowerment, because with new technologies, patients nowadays can have all kind of information through social media. But what we would like to have is that the patient can make a well-informed choice to have the best targeted personalized medicine. So that's what we would like to have, and this is something very important for the national health authorities, because they are responsible to get neutral and patient-centered information, which is not always guaranteed when the information comes from the industry. So we have a role to play as a national actor, and we have to play it for the patient.
The patient voice is going to become more and more important. To listen to what's important for them, they become very knowledgeable people about their own disease states, and that knowledge is very powerful. And I know we have to be careful about, sharing data and protecting patient data and so on and so forth. But there are a lot of patients who want to share data. They want to share their experience. They want to share their ideas, and they want to share if they can help them and people like them, they're willing to share at an unprecedented level. So we need to be careful. We need to be balanced in that approach, but we're also, I think, going to have to really listen very carefully to what they are saying.
Well, there's quite a strong emphasis on the fact that it must be patient-centred, because that's what it's about. It's about the right medicine, the right place. And given that I do quite a bit of work in the Parliament, supporting the voluntary sector, I think more emphasis needs to be given to organisations that represent patients, because I think they have a very significant role to play, not least, for example, in the area of health literacy, both in informing patients about their disease, about over-treatment, under-treatment, etc., but also empowering patients, because, personalised medicine isn't just about a doctor or a health professional giving me something, a particular treatment. That's part of it, but the other part of it is that I play a role in, ensuring my own health and working with the health professional. So I think patient, organisations have a significant role to play. The other issue I think that I was very pleased to see there was the fact that it speaks about the upskilling of health professionals to make sure that they understand the new technologies they use. So at the end of the day, we get the best possible outcomes.
We do believe that we need tangible actions now in order to improve access to better treatment for patients. So all this is good, but let's see some better mechanisms and concrete actions in place for patients that really need better treatment.
Do you think the EU, now the conclusions are out, really needs to push the member states to act on these?
Absolutely, because we know that it's always at the level of member states, so it's up to the countries. So as we've said it before, we hope that member states will find an incentive to be more active and to find solutions at the local level.
I think that the Luxembourg presidency conclusions actually point at a very important matter, which is the complexity of research into personalized medicine and the need to break the clusters in which everybody works today. So what kind of silos do we need to break? First, we need programs that, which, like in the Innovative Medicines Initiative, bring together different projects and different results in order to create synergies and exploit them in a much better way. We also need projects which bring together public and private contributors, and from big and small companies and across different specialties, not only life sciences, but also technology providers from outside of life sciences. We also need to break another silo and bring together people who would be using these methodologies and these approaches in their daily practice. This would be patients, payers, regulators, HTA bodies, as well as healthcare systems in general. And unless you do that, you wouldn't be able to really exploit personalized medicine potential. And finally, and most importantly, you also need safe harbors, the places where you can take research results and test all new innovative ideas on real-life research and in real-life healthcare systems. And only European, pan-European research, like the one financed by the European Research funds, can actually achieve this.
And from the perspective of science, we have also to play our role, more rapidly translate the scientific results into the clinics and to the patients and back. But not only science, also with all the players like industry, we have to work multi-sectoral.
There is a real need to ensure that all member states develop actual adequate access mechanisms for IVDs. And also the value diagnostic brings to EU citizens and patients, enabling both the quality of care while sustaining the health systems, need to be better understood, better recognized and rewarded.
It is very important that Frontline speaks up and Frontline collects data and Frontline observes. These are, in my view, the key issues where nurses can contribute to the future developments. And of course there are gaps. Gaps in the sense of education, where we will need to look at the European legislation on mutual recognition that we have, but also on continuous professional development, the workforce we have already.
You know, I'm responsible for education in the European Association of Urology. So I believe that education of health professionals and health providers is the most important to make this personalized medicine come true.
I'm looking forward very pro-European, very ambitious program for personalized medicine. That means that we should have a common policy about genuine information, policies how to gather it and how to take care of the data protection so that it is the property of the person itself, and the big data can be then used on development of personalized medicine. And to me, Europe can be in a leading position on personalized medicine, and that would be benefit for the patients and benefit for our businesses.
For a company like Intel, of course, computing is paramount. And indeed, in this area of personalized medicine, the wealth of information that needs to be analyzed and processed is key, and thus it requires advanced computing.
We are always focused on two issues. First of all, to give the guarantees for the patient, because he has to get some guarantees that his personal data information are protected, and that he can depend on these guarantees. But on the other hand, his data might also be used to bring innovation and to give important input for research and for new health issues. So we have to combine the two, personal guarantees for data protection for the patient, and on the other side with securities which have to be adopted in an open way to encourage innovation and new targeted health issues.
So a fine balance. Thank you very much, Minister.
Thank you so much.